Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I have the privilege of hosting the program this evening, and I'm so glad you joined us. I know we have our regular crew that joins us every week, and so you know the routine. We are live in the studio. We have a physician here as a guest tonight. We have a gastroenterologist with us, so a lot of interesting things to talk about, and we welcome your questions. So please take advantage of that. That's why we keep the phone number to reach us at the bottom of the screen throughout the program, and also now you can text. And that's a great way to get any questions you may want to ask the doctor taken care of. So let's talk about calling. It's super easy. So it's 969-2720. If you're outside of Fort Wayne, it is still a free call. Just dial 866 and then the rest of the number. You talk to a call screener, a very nice person. They will not just throw you on the air. You can ask your question on the air. I always recommend that because that way you can interact with the doctor. He may want to ask you more questions to be able to give you a better answer. So that's one option. The other one is you can just tell the call screener what you want to ask. They'll relay that to me and I'll ask the question for you. And then let's get to the texting. So that is a little different number, close. It's 260-969. It's 2730. And I want to tell you that your phone number stays private, so don't worry about that. If you feel comfortable giving us maybe your first name and even telling us where you're calling from, and then just a brief question, and then we'll get your question answered that way. So lots of options. Just want to make you aware of that, and feel free to call at any time between now and about 5 till 8. So take advantage of the time that you have to get some free advice. Let's go ahead and meet our guest tonight. As I said, we have a gastroenterologist. This is Dr. Praveen Sateesh. And so nice to have you on the show.
Well, thank you for having me.
Thank you. And you know, we don't often get to do gastroenterologist programs, so this will be fascinating because I was telling you before the show, I feel like I meet so many people who have some kind of a GI issue. And you see so many commercials now, if you pay attention, that are, to treat irritable bowel syndrome, Crohn's disease, things that are GI related. And so that right there kind of tells you it's a prevalent issue in our society today. Yeah, absolutely. You tend to see a lot of GI-related symptoms, GI-related pathology in pretty much any community. It tends to be pretty prevalent. And I know we wanted to talk about colonoscopies, everybody's favorite topic for sure, but that's a great way to get some answers. And I know you and I were talking before, I have two children, two of my children have Crohn's disease, so you learn a lot about what all these tests can tell you, but that was like the first thing that we had to do was a colonoscopy, and I don't know if you want to talk about that. I mean, I think it's the prep that scares people the most. Yeah, that's probably the toughest part of the procedure is the prep, cleaning yourself out. We do have different options now that weren't there years ago, including a tablet prep as well that might help some people that have struggled with the traditional prep with nausea. Still requires drinking quite a bit of water though, along with the tablet prep. But it's not that they used to give you a certain kind of fluid to drink, and I know I just remember my grandparents saying that was horrible. They said it tasted like charcoal. I don't know why they described it like that, but now you can just do like things that would give you enough electrolytes, like a sports drink or water. Yep, you can. So that old prep or the Go Lightly is still what we use predominantly because it provides the best results when you talk about a clean out, us being able to get a good look. But the salty nature of it, the taste of it, sometimes people can't tolerate it. You can get flavor packets for it. Oh, okay. And I always tell them, pick a flavor you don't mind never tasting again. Oh, yeah, that's true. Bad memories. Yeah, bad memories. Okay, but even just the result of the prep, it's, a night where you're in the bathroom quite a bit as you're getting cleaned out. So, But the actual procedure itself is pretty easy. You're asleep, so you don't feel it. It doesn't hurt. And there's no pain afterward, typically? Typically, no pain. Okay. Some people may have just a little bit of bloating that can go away pretty quickly. Okay. But, in general, how long would you say the colonoscopy itself lasts, the procedure? Oh, the procedure itself could be anywhere from 15 to 30 minutes. Oh, it's really short. Yeah, it's not a long procedure. Everything that surrounds it can take longer, coming in, getting prepped, getting an IV, meeting the anesthesiologist, and all of that. So. And what kind of answers can you get from the colonoscopy? Because I know when I took my sons, they actually printed out pictures so that we could see what the inside of their intestines look like for trouble spot areas.
Yeah, absolutely.
So,
And anything that you would see, any inflammation, ulcers, sources for bleeding in those situations, colon polyps.
Yeah. So can you talk about polyps?
Sure.
Because I don't think, I don't think most people probably know exactly what you mean. I mean, it's almost like a little growth inside the colon?
Kind of like, you can think of it like a little skin tag, but within the colon, inside the colon, obviously different tissue than what the skin is.
Okay.
But some colon polyps can be benign, and some colon polyps, if left unchecked, can grow and eventually become colon cancer.
So can you eyeball it and just know from looking at it if it's troublesome, or do you typically always biopsy each one? Or
well, yes, you can kind of make good educated guesses on which are going to be precancerous versus which are going to be benign, but we typically send all of the polyps to pathology to confirm. Yeah.
And then if if there was an issue, it came back positive for colon cancer, I mean, can you remove the polyps? Does that help with the colon cancer?
Right.
Is that
so? That's the main benefit of a colonoscopy when you're talking about colon cancer screening, is that the colonoscopy is the only test where you can remove these polyps and hence prevent colon cancer. So removing a polyp that is precancerous effectively prevents that polyp from becoming cancer in the future.
And is this correct? I mean, if you come back away with a clean bill of health, if it looked okay, are you typically good? Is it 7 to 10 years? You might not have to do that again?
For the general population and somebody that doesn't have like family history, a genetic cancer syndrome, or they themselves have had a previous colonoscopy where there were polyps removed, then typically it's every 7 to 10 years for the screening.
Okay.
Yeah.
All right. So it's a challenge, but then it's different probably than most other medical procedures. So.
Yeah. It is one of the things that I would say people don't look forward to getting done, and that is a challenge. I think the importance though is that when we're talking about colon cancer. It is the third most common cancer in the U.S. And one of the more preventable ones. Getting your colonoscopies at the right age, and typically for somebody that doesn't have high risk factors like a family history, that age is now 45. It's really one of the cancers that you can prevent. And so there are other methods to screen, but really the colonoscopy is the gold standard for not just screening, but prevention.
Yeah, I wanted to talk to you about some of the other options that people have for screening, but I did want to address a text message that we got.
Sure.
So it was from Wesley. He's from Fort Wayne, and he wanted to know, if colonoscopies can help to diagnose GI problems. So maybe not just the cancer, but it can there are a lot of other diseases and things you can have in your intestinal tract.
Absolutely, and depending on what your symptoms are, things like inflammatory bowel disease, like we were discussing, Crohn's disease, ulcerative colitis, those are chronic GI diseases that do require medication and long-term management. So
yeah, there's no cure for them yet,
no.
But you just have to manage it.
Yeah, the treatment is really suppression and just management and the medications now are really good when we're talking about inflammatory bowel disease. And managing and keeping the disease in remission, but there's no cure. That's true.
And we've come a long way because, growing up, of course, I'm older than you, but I remember, we never heard about anything like inflammatory bowel disease, or, you knew of people maybe who had upset stomach all the time, and they would, just take some over-the-counter medication to kind of quell things. But I feel like now most people would be familiar with it and not embarrassed to talk about it.
Right, and there's foundations out there, like the Crohn's and Colitis Foundation, plenty of social media groups that people are a part of that have the disease. And so, there's a lot of, just a lot of community regarding that, a lot of support with that. So
yeah, it is not a pleasant thing to have, and there's can be a social stigma associated with it.
Sure.
And and it's no joke. You see these commercials where people are always, a lot of them will say, "I always had to make sure I was near a bathroom," and you do, because sometimes you just don't know when you're going to have a flare up or an issue. So
right, and those are difficult disorders to live with, and really getting them diagnosed is the first step, and then treatment can really change your life.
Sure. Yeah. I can attest to that. So I want to get another question in. So this was somebody, this was Donna, called in, and she said, what do you think of the use? Okay, this is what we were going to talk about. We were going to talk about other things you could use to diagnose cancer screening. One of them you've probably heard of is called Cologuard. And you do it by mail. So I don't know if she's asking, what's your opinion of that? So if you want to talk first about what do you do, and maybe, how effective it is or not? Yeah,
so I mean, that is probably the alternative to a colonoscopy at this point, the main one in colon cancer screening. It is, like you had mentioned, it's a stool test that you can mail in, and your primary care doctor can order it. Now, the one thing is that with Cologuard, that is approved for patients that don't have family history or a history of polyps. It's not approved for those patients, only colonoscopy. And secondly, Cologuard, even though it's an alternative screening test, it doesn't detect polyps as well. So really, the colonoscopy is the gold standard for prevention, detecting polyps, removing polyps, and preventing colon cancer. Whereas Cologuard has a higher likelihood of missing that. So you can have false negative results when it comes to polyps. Any positive Cologuard, though, does require a colonoscopy. Yeah, because then you could have either colon cancer or colon polyps, which would need to be removed.
So I'm just wondering, because you and I were talking, and you had mentioned this in the show too, that 45 is now the recommended age. So insurance is probably going to cover it. But say you're younger than 45 and you're, just a little concerned. I mean, is that probably, if you didn't want to go through the hassle of a colonoscopy at that younger age, is this maybe something that you might want to consider? Yeah,
I mean, at a younger age, I think if you're having symptoms, because what would kind of prompts a younger person to worry, they may be having some symptoms, and that could be rectal bleeding, that could be change in bowel habits, it could be abdominal pain, or it could be just some very vague symptoms. And that's the scary part about colon cancer, is that it doesn't necessarily have a hallmark symptom. It can present very vaguely or with no symptoms at all. So I would say if you're younger, the key being early detection, removal of polyps, and I think combined with the fact that a Cologuard may miss that, I think if you're younger having symptoms, I would highly advise it being a colonoscopy at that point, because we are seeing an increase in younger people under the age of 50 developing colon cancer.
Yeah, I was shocked at these statistics. 159,000 new cases of colon cancer every year, and then 55,000 deaths every year. And like you said, it's the third leading cause, third most common
cause of cancer in the U.S. behind breast and prostate.
And it is very. I mean, it's just sad. I've never, and I don't want to, I mean, you would know better than me, but in my own personal life, people I've known who've had colon cancer do not survive it. They may be able to have some treatments to tie them over for a while, but it's sad, and some of them have been quite young. Yeah,
it can get pretty aggressive, especially if you're not getting screened, or maybe ignoring symptoms. But there are, as to any cancers, there's stages to it. So even, catching a colon cancer at an earlier stage, you still have the possibility where a surgery removing that part of the colon could be curative.
Okay. All right. Well, and I was going to remind everybody to call or text us. We have the phone numbers at the bottom of the screen. We did just get another text, so I'll go ahead and ask you this question, Dr. Sateesh. So this is from Lucas from Fort Wayne. He says he can't gain weight because of undiagnosed digestive issues, and what should he do to help himself gain weight?
Yeah. So Lucas, have you seen a gastroenterologist and they've done tests?
Or actually, this was a text.
Oh, it's a text.
I'm sorry, doctor.
So, no problem.
So he should probably.
I think definitely talking to your primary
start with your family doctor?
Talk with your family doctor. There's a variety of reasons for not being able to gain weight. And again, one of those vague symptoms, does Lucas need further testing to rule out other conditions if he hasn't had it done? So I would first start with your family doctor, and they can determine if you need a referral to a gastroenterologist.
Yeah.
So,
Well, and it's another issue I find, with my children in school, we meet so many kids who have issues, and it started with that, not being able to gain weight or losing weight, and a lot of it's the gluten issue. Celiac disease, and I'm shocked at how many people, have that as well. You never heard about that, when I was growing up. So
many things that probably were there that just never were diagnosed.
Okay.
Because people weren't coming in to get seen or getting the endoscopy tests, getting the diagnoses. And celiac is one of those that we're seeing more and more.
Yeah.
Is there an increase in celiac, or is it just a difference between who's actually getting tested now versus in the past? Yeah.
And do you think it's an issue? Some of these things are autoimmune diseases, I realize that, but do you think part of it is your lifestyle? Do you want to address that part, or your eating habits?
So there's no clear causative thing that's been determined, but I think just correlation being that I think, and we see this predominantly in Western countries too, when you see all this GI pathology. And diet and lifestyle, I think, are very associated with that. So there's, an increase in obesity and metabolic syndrome in general, diabetes, and there's strong connections between that and our gut health. So that's probably one of the leading contenders as a cause.
Try and keep your weight under control.
Healthy life, healthy eating, healthy body. So
it's just we have a busy lifestyle. I feel like if you look at other, I remember when I was studying foreign language, I took French, and they were talking about the whole country shuts down every day for 2 hours, and they just have a nice meal, and which included wine or and just cheese and all that. And that would never happen in this country. We don't slow down.
We have lifestyles that require convenience, especially with our eating habits.
Yeah.
And you're right, you can see this in other cultures and other countries where people are picking up fresh produce, fresh meat on their way home from work, cooking that, whereas we tend to pick up things from supermarkets or get fast food a lot more.
Yeah, so, well, and they a lot of the supermarkets offer almost like fast food to go. They'll make stuff in their deli or whatnot and then send it home. So. I just want to remind everybody that we don't have a whole lot of time left, and if you want to get a question answered, please feel free to call us, 969-2720. You can text us, 969-2730. We still have enough time to get some more questions in, but I just wanted to remind you of that before the time slips away. So looks like we are getting another text message in right now, Dr. Sateesh. So this is from Diane. She's from Fort Wayne, and she says if she is an adult diagnosed with, is it carcinoid of the small intestine, she wanted to know if she should have her child tested, with genetic testing. And I didn't know if that was a common hereditary issue.
Yeah, no, it's a little different than what we're talking about with some of the genetic cancer tests or the genetic cancer syndromes that relate more to colon cancer. Carcinoid tends not to fall under what we call adenocarcinoma, which is what we're primarily thinking about when we talk about the colon and colon cancer.
Okay.
You can have carcinoids in the colon, you can have carcinoids in the small intestine.
All right.
And typically, there's a solitary carcinoid versus carcinoid syndrome. And I guess long answer short, no, you don't need to have your child genetically tested, but if your child is having symptoms, probably should get evaluated as well to see.
Okay. All right, great. So I wanted to, can we just quickly go over some of you said not everybody presents symptoms with colon cancer,
Correct.
but I know you sent me a list of common symptoms if you do experience them, so I don't know if you want to remind people things to look for.
So common symptoms tend to be rectal bleeding, red rectal bleeding. You can also see black tarry stools, which could be an indication of bleeding as well in your intestinal tract.
Okay.
Diarrhea, constipation, a change in bowel habits or a change in stool caliber, abdominal pain, unexpected weight loss, vague symptoms that some people may attribute it to being more irritable bowel.
Yeah.
typically we would have a low threshold to investigate with endoscopy or in a colonoscopy, just to rule out things like colon cancer, rule out things like ulcerative colitis, rule out Crohn's, because they can present so vaguely. Yeah.
And it's not like you were saying before, it can be an aggressive cancer for sure. So.
Yeah, absolutely.
There was something else I wanted to ask you about. So this was new to me, another thing in the family of colon cancer screening tests, the FIT test,
yes.
F-I-T. Now one I had not heard of before. I don't know if you can talk about that.
Yeah, it's also a stool-based test, and honestly it has kind of been pushed aside by Cologuard. Because,
you don't hear about the FIT one very much.
Yeah, but it used to be an alternative to the colonoscopy, which is a stool-based test, and there may be some places that still use that. A positive FIT test would also indicate that you would need to have a colonoscopy. But it also suffers from the same drawbacks as the Cologuard, is it's not very good at knowing if you have polyps in your colon.
Okay, so it's kind of the same thing where you mail in a stool sample?
Yeah. And I think there's maybe certain institutions that may still use it, like the VA system.
Yeah. All right. Again, they just showed me the cue card. We just have a few minutes left, but enough time to get a question or two in. So please take advantage of that by calling the number of the screen, bottom of your screen, or texting us a question. We've had a lot of good text messages and also people calling in questions. So do you want to talk about just the average, the risk, that you've seen it jump up? You have a lot more. That's why they lowered the age of the colonoscopy. It used to be 50 to 45. Any thoughts on what caused that?
So 30 years ago, the proportion of patients under the age of 50 that had colon cancer was 11%.
Okay.
Now it's 20% more recently. So you're seeing an increase in that younger patient population. Why? Again, I think it has a lot to do with diet, lifestyle, metabolic syndrome, obesity, diabetes. There's a lot of thought that might be prevalent, more prevalent now than it was 30 years ago.
Okay, yeah, it's just interesting. Usually when they lower it by that, to that, and you said it might even go low. You suspect it could go even lower.
I think, who knows what the future will hold, but it was just lowered to 45, 5-6 years ago.
Yeah.
Could it be lowered even more in the future? I think if this trend continues, for sure, we'll see it lowered.
Okay. All right, I'm going to see. We just have a couple minutes left, but we did get another text, so let's see if we can get this real quickly. Mark is a 76-year-old man and had one colonoscopy at age 45 with a growth that was found and removed. So he wanted to know, he's 76 now, so is there an age after which colonoscopies are no longer performed or maybe no longer needed?
A lot of it also depends on the individual patient and their overall health status. But typically between 75 and 80 is when you would stop doing screening colonoscopies. Now, if someone had a colonoscopy at 45, even if there were no polyps or growths found, they would still need to have another one at age 55 and then 65 if they don't have any polyps.
Okay.
If you do have polyps, depending on if those were precancerous polyps or not, it could be sooner that you would need to have your next colonoscopy.
Sure.
But typically, I usually use a cutoff age of 80 because people are living longer nowadays.
Sure, yeah.
But anywhere between 75 and 80, and that really depends on the patient's overall health status. If they have a lot of other illnesses, it may not benefit them to have a colonoscopy, depending on their comorbidities. Then again, I've met patients in their 80s that are incredibly healthy and would likely benefit from having a colonoscopy.
Really? Okay, so it's a case-by-case situation.
I would say it's a case-by-case and the patient's personal preferences. So, I think, the cliche that age is just a number really is true. But according to the guidelines, and then this also may be dictated by one's insurance, typically it's between 75 and 80 that we stop doing colonoscopies for screening purposes.
Okay, so if you had an issue,
if you have symptoms, you may still need one.
Okay. See, some good things can come with getting older. So I try
No,
and
for
tell myself that
colonoscopies,
every
yeah.
day, but I don't always believe it. So well, unfortunately, we are out of time. It was a wonderful show. Dr. Praveen Sateesh, thank you so much. Really a pleasure to have you tonight. So, and I think we all learned a lot. I appreciate all of you who called in or texted in questions. Thank you so much. Take care. And just want to remind everybody, we have some severe weather that could be hitting us overnight. So please do take care. Of course, we at PBS Fort Wayne, we have that weather radar. So listen to that. They will sound the alarm if we have some severe weather headed our way. Take care. I'm Jennifer Blomquist. Have a great rest of your week. Bye-bye.
The preceding program on PBS Fort Wayne is made possible in part by...
You gotta find your people.
Good morning.
The ones that make you feel whole.
Good. How you feeling?
You look so pretty today.
Bring it together, you got nothing to lose.
Good job.
In a world full of strangers, you don't know who to trust. You can't go it alone. Everybody needs help.
Go.
You gotta find your people, then you'll find yourself.